All right. Well, thank you to all those of you who have joined us today for our webinar today, something we're terming as the Pandemic Life Series, just as we've all kind of come to learn how to live and navigate this world the last year or so. We're presenting this to you today. So the topic today we're going to be covering is a little bit when self-care isn't enough. Our last talk that we gave about a month ago just talked about ways to engage in self-care when possibly self-care isn't quite enough anymore for us. We're having that conversation here today. So thank you for joining. We just appreciate it. It's up to you. You're welcome to keep your screens on or your cameras if you would want. Otherwise, we'd appreciate if just for the time being, if people would mute their computers at this time, just so we don't have interference from microphones and so on. Also, if you have any questions along the way, you're welcome to use the chat feature down below. If you're using Zoom and familiar with it, you can just type out a chat either directly to me, Todd Ostwinkle, or my co-host today, Lindsay Hagman. So feel free to either direct that to one of us or just ask a general question. And today, to try to stay on time, since maybe many people are joining us over their lunch break, presenting today is myself, Todd Ostwinkle. I'm a licensed mental health counselor here at Catholic Charities in Dubuque, Iowa. And I'm joined today by Lindsay. You want to give a little introduction, Lindsay?
Thanks again for being here. My name is Lindsay Hagman. I have been a counselor for about 6 years now, and in the Dubuque office working for Catholic Charities since December. So I'm happy to be here with you. Thank you for being here.
Very good. So today's agenda, it looks like a lot of things to cover here in an hour, but just a general talk today about, number one, reviewing what self-care is. Then we'll move on to talking a little bit about the warning signs of what would be maybe general stress versus psychiatric concerns. For those of you who are working in an allied field, maybe how to identify it a little bit in a patient or a customer. For those of you who may be attending our talk here today, just to learn a few things for yourself, what types of concerns come up with just general stress versus brain health concerns. We'll talk a few minutes about the myths about brain health that come up quite frequently that cause barriers for us to find or help people get to services. And we'll talk a little bit about how to encourage somebody to get help, or maybe how to get help for ourselves or somebody else.
Yeah, so just a couple of things before I talk about our mission. So Todd mentioned earlier, but for people who just jumped on, if you would like to leave your camera up, you absolutely can. It is kind of helpful for us to have that feedback and to see if things are registering or if we need to clarify anything. Also, we will have time at the end for any questions. So you can jot those down, hold on to them if you'd like to talk about them and have them addressed. Or as Todd said, you can always either direct message us or ask a question in the chat throughout the talk. So for those of you who are not familiar with Catholic Charities and what we do, our mission is to reduce poverty, to strengthen families, and empower communities. Some of the things that we do are we help families, seniors, and adults with disabilities get affordable housing. We offer professional mental health counseling to individuals, families, and couples. We also help those who are recently released from jail or prison and in need of mentoring or support through our jail and prison reentry program. We also have a program for immigrants who are in need of professional and affordable immigration and legal services. We provide these services to anyone in need, regardless of their faith or background, and we believe that every person deserves to be treated with dignity and respect. So, because some of you may have been at our last talk where we went a little bit more depth into self-care. Some of you may have not seen that. I just wanted to give you a heads up that if you received an email invite to this talk, there was a link to that, but also after this talk, we'll try to send out another email link. And if you'd like to go back and watch that one, because you'd just like to learn a little bit more about how to make time for yourself, how to establish a good self-care and coping routine, you can watch that one as well. So we won't go over everything that we talked about in that talk, but we just kind of wanted to touch base on some of the things. So one of the first things is knowing your stress scale. So kind of being able to check in with your own emotions, check in with your own stress level, and give yourself an honest assessment of how you're doing right now. Sometimes we're just in survival mode. We forget to check in and see how we're doing, or forget to check in with people closest to us. Sometimes we don't pick up on the fact that we've been extra stressed, extra anxious, extra moody or grumpy, and the people close to us can let us know that. And then we challenged everyone last time to come up with 3 self-care activities. So new ones that were outside of your repertoire, whether that was getting in an exercise routine, eating healthy, using creative skills to build or to make something, engaging in hobbies, or trying to get creative with how you socialize and find support. So just want to challenge you again, how is that going? Have you been engaging in those social or those self-care activities? How can you do better? How can you add more self-care things? Another thing we really emphasized was slowing down and making time for self-care. Oftentimes we feel like everything else and everyone else is more important than making time for ourselves. But if we don't fill up our own cup, then we don't have anything left over to pour into people around us. So we have to prioritize ourselves to a certain extent to make sure our own needs are being met so that we have something to give to people around us. If you watched that first video, or if you go back and watch it now, if you feel like I'm doing all the things that were discussed there, I'm in a good routine, I try to exercise, I try to do these things that we talked about, and I'm still feeling stuck, I'm still feeling overwhelmed, or I feel so stuck that I can't even engage in those things, then we're going to talk about what's next for you. What's kind of the next step? How do you know that it's more than what self-care can handle?
So as a part of the talk here today, the idea of the pandemic the last year has caused a lot of us to maybe wonder or feel certain ways about our overall health and well-being, both with friends or family, our social lives, and our emotional or mental wellness. So a piece of that is for individuals who are maybe doing those self-care things that Lindsay talked about, or really engaging in those and finding, I'm not sure if it's really helping, or it's helping a little bit, but gosh, there's still some lingering kind of concerns. Then we come up to start trying to find out, is this something that's related to the pandemic at large? Or of course, is it something else? Is it in this realm for our conversation today? Is it related to something with brain health or psychiatric concerns? Again, noticing it ourselves or in somebody else. So the main thing I ask people to consider when they come to see me as a counselor, and they might say, this has only started to occur recently, and we kind of explore that, is trying to find out, is this pandemic stress or anxiety or moments of depression, are they specifically due to the pandemic? So the main question I like people to consider if it's pandemic focused is, did you feel the way you're feeling emotionally or situations that are going on prior to the pandemic in this case? And taking some time to really kind of think, did I have these thoughts or feelings or emotions or struggles just more recently, the last 6 months or a year? Or has it been longer? If we really identify that, like, gosh, this has been going on longer than sometimes I care to share or admit. Um, and I have a few topic things that are typically the most commonly reported concerns that people come visit our counseling office for is general stress or anxiety or depression. But this is going to be kind of a shortened look at our brain health or things that can affect us. Um, Sometimes these things are legitimate, even though folks are like, well, it's just the pandemic. That's why I'm stressed or I'm having anxiety or I'm feeling depressed. In this case, sometimes the pandemic might have started it off, or we might have actually been developing it the whole time, this new concern for us that we want to address. So hopefully we take an opportunity to say, maybe it's not just, what's going on in our environment and world right now. Could be something a little bit more. And just on the topics of our three main concerns that we see here is a lot of times people ask, well, what is really stress? We often say that I feel stressed or I feel overwhelmed by things. Stress, I like to remind everybody, is very present focused. We all experience stress and anxiety periodically during our life. They're very natural. One of the big differences is that stress is, again, a response to something that's very present, oftentimes a threat, something going on at our job, something happening with a family member or significant other, or children, or just other things in our life, our vehicles. So many different things can cause us present stress. But anxiety typically comes from stress. So we start getting future focused. Things like, what if my car doesn't get repaired in time? That's both stress, and now we're worried about the future. What if I catch this coronavirus and I get really, really sick and I can't take care of myself and my family? And again, possibilities, but again, how frequent this is coming up, and is that a possibility? So anxiety often comes with what if thinking. Even if we don't say it in our mind exactly that way, it's talking about what if this happens, or we start worrying. Very different kinds of topics keep coming up about money or family or job or an illness. Those are all parts of anxiety. And if it's more chronic and it's been coming up for a longer time, usually we like to say 6 months or more, that could be a sign that it's something else. It's not just related to the pandemic. And on the other side, I guess in a way, is our feelings if we're feeling depressed, right? Of course, the pandemic has caused a lot of people to feel down, depressed, isolated, somewhat alone. But again, if these feelings have been there longer or are not just related to the pandemic, we might be experiencing with depression some low mood, not having a lot of energy, and sometimes not engaging in things we enjoy. So we have a lot of different kinds of symptoms. And a lot of folks say, especially in these webinar talks, well, I'd really like to find out if this fits me or fits somebody I know. There's a lot of common warning signs we as therapists look at. In this case, and Lindsay, I'll let you talk about that a bit.
Yeah. So these are some pretty significant red flags that can let you know that there's something serious going on that could use a little extra professional help, maybe. So feeling very sad or withdrawn for more than 2 weeks, trying to harm or end one's life or making plans to do so. So that's any kind of suicidal thinking or feeling like you might hurt someone else. Severe out of control risk-taking behavior that causes harm to self or others. This could be something like out of control shopping, whether it's online shopping or in person, where it almost feels like it's meeting a need, or we're trying to cope or avoid something by engaging in this behavior, but that can become very risky behavior when it's running up credit card debt, or it might be missing days and days of work because of stress, mental health issues, not feeling good. that those can be considered that risk-taking behavior, because it can cause harm to, that can cause you to lose your job, that can cause you to go into severe debt, that can cause a lot of issues later on. Another one is sudden overwhelming fear for no reason. Oftentimes there's a physical component to this. So we might feel like our heart is beating out of our chest. We might get shaky hands. We might start to feel sick to our stomach. We might notice that our breathing is increasing. And that's a reaction to that fear, some of these anxious thoughts that are rolling around in our head. Any significant weight loss or gain, seeing, hearing, or believing things that aren't really there, excessive use of alcohol or drugs. Maybe we don't recognize this as a problem, but if somebody around us has notified us that this is an issue, or if we realize that we're starting to depend on it a little bit more than having it be a social or every once in a while thing. Drastic changes in mood, behavior, personality, or sleeping habits. Extreme difficulty concentrating or staying still. Intense worries or fears that get in the way of daily activities, and feeling panicked frequently. So if you notice one of these things, if you notice that, oh, I'm having trouble sleeping, that doesn't necessarily mean that it's one of these red flags. If you notice one or more of these things in yourself or someone else, that's probably a pretty good indicator. Also, another thing that we look at is, how is this affecting the rest of your life? Is this impeding your relationship? Is this causing fights between you and your spouse? Is this impeding your ability to do your job? Have you gotten notices at work that your work's not at the level that it usually is? If you're getting in trouble for missing work, or if it's having a negative impact on other relationships or other areas of your life, that's a pretty good indicator that there's something going on that it'd be good to reach out for help. Or if you notice this in someone else, a loved one, a colleague, to maybe have a serious talk with them about how you can support them and how you can help them to get help.
So one of the main things, and this often comes up for many people, I think the community, and both in Dubuque here and hopefully other areas abroad, are doing a lot of work talking about mental health and brain health, and really starting to break down some of the barriers, myths, and stigmas around it. But again, when we talk about seeking help, either due to the pandemic or just for our own general wellness or somebody else's, one of the big things that starts coming up is the myths that really start to surround brain health and getting treatment. And some of the myths about mental health stem from maybe common misunderstandings, suspected origins, frustrations, complaints, and sometimes from many, many years ago. A very ancient practice was a term we call trepanning, where we believe that sometimes evil spirits resided in people's minds. So unfortunately, they would drill holes in a person's head to release those demons that might have been causing a psychiatric concern. So obviously, anybody that maybe in olden times had a psychiatric concern, of course, everybody said, "Oh, you don't want to have that because this is what will happen to you." So that starts becoming a misunderstanding or a myth or an origin, because we didn't know, some hundreds of years ago, how brain health or psychiatric concerns could be helped. So we tried to find ways. And some of the myths that we make up about it, unfortunately, often degrade or pressure individuals living with those concerns to either suppress those feelings or actually scares them away from getting support. And, we'll take a little poll here for those that can participate with it. We'll find out what are maybe some of the myths you heard based on the list you see. If you could just click and do that, that would be wonderful. Thank you. I appreciate for those that are able to click into this and people want to keep adding in. But, obviously, one of the first things that shows to be very high, at least so far with our polling, that is now closed there. 71% of everybody that's viewing right now is, this myth that people with mental health problems or concerns can just snap out of it if they try hard enough. And for any of us that work in allied fields or fellow counselors, uh, we know that that's not really the case because there is a brain health often component with it. Just looking here very quickly, you know, individuals saying that, God doesn't give you more than you can handle. Again, we want to take faith that, God doesn't place more in our hands than we can handle. But sometimes life can. And in a way, it's a real subtle way to say you can handle this, but we really don't need any help. And that can be misinterpreted that way. And one of the other high ones, frequently, yes, is if I go see a counselor or if I take a medicine, I'll be judged. And that really shows how much that stigma and some of these myths really do remain in our time. So advocacy is so important yet. So thank you all for doing that. So we talked about some of the, or at least shared about some of the common warning signs. And for those who might be joining us here today that are searching for yourself, or we are looking for somebody else, in this case, that here's some signs that somebody could benefit from it, which are along with those, those common kind of warning signs. And we did have somebody reach out on the chat here, also saying one of the frequently heard things, just back with our former slide, is that my kids will be taken away from me if I'm quote unquote crazy. And as I've worked in the field as well, yes, that individuals sometimes don't want to seek help or support because they are definitely afraid that there's this myth that human services will come in because you see a counselor and take children away, which again perpetuates what's really going on there. Thank you for that. Some of those signs, and again, not to read off fully from this list, but again, things that myself, or the big thing is we notice in others feeling sad or angry or not themselves, abusing substances or behaviors to cope. And probably two to put together is losing someone or something that's important to you, or something traumatic has happened to you or somebody else, and you notice definite changes. A lot of times with trauma, I like to talk about what we call the big T's and the little T's of trauma. And most people would like to think, well, you can't have a post-traumatic stress. You can't say anything's too bad because it's not a big enough thing, a big T trauma. Well, you've never been assaulted or sexually assaulted. You've never been in a car accident or a natural disaster. You've never had your house burned down. So you can't have a traumatic experience in your life. That's a big T kind of trauma that really sticks with us. However, most of us in our lives do experience little T traumas, losing a job, a close family member dying that we really cared about. And that can be a big T trauma as well. Other little T traumas is hearing kind of the same negative viewpoints about you often, or somebody else has heard that. Big T trauma can be bullying. Sometimes that can be a little T that's just gone on through different years of our life. So we might benefit, or someone we know might benefit from counseling because they've had either kind of traumatic experience or have talked about. Some of the other things is you can't, or someone else can't do things they like, withdrawing from things they enjoy. Or sometimes just flat out, we need some unbiased source of support to help us walk through something. So a little bit of a gentle approach to help someone is some conversation starters. So myths and the stigmas make discussing brain health concerns or mental health very uncomfortable. sometimes for us as the person asking, uh, sometimes for that person receiving that. Again, something like, my kids will be taken away, so I don't want to talk about this. So I ask people, if we're going to approach somebody else, or sometimes even having that little self conversation, we're going to have to expect some discomfort. Hopefully, the conversation is well worth it. And hopefully, we can help that person or remind ourselves that we want to decrease that stigma through feeling supported. So I encourage some gentle conversation starters, such as, how are you feeling? And we do have a social nicety when, at least locally, I've noticed, when we say, how are you feeling? We get a very generic response. I'm good, or I'm fine. Oh, it's a tough day, but I'll get through. And we just kind of leave it at that. So I ask, if we do have a private time to talk to somebody else and we notice there's a concern, hopefully following up with, like, no, and gently, how are you really feeling? And the next piece comes after that. I have noticed, and I leave that blank to try to put in a really specific behavior, but not a criticism. Like, I've noticed you've been a little more withdrawn, or I haven't seen you at lunch lately, or, I've noticed you've gotten frustrated more easily. How are you really feeling? Or, what's going on for you? And it can be tough because sometimes people have difficulty articulating it. Or again, because of that stigma, we want to push away from that and not talk about it. But if we can start a conversation and have a little bit of one, or maybe return to it a couple times, eventually we can get to that point where we might ask that person or child or family member, or friend, coworker, what do you think about seeing a counselor? And we're only asking what that person thinks to really try to see if there is a lot of stigma or not feeling supported. Um, so I hope that that can be something that we can help advocate for that person and support them in getting support.
And I just wanted to add, sometimes when someone does start to open up, whether it's after we've asked, or sometimes we run into that person when they're having a rough day and you are the person that they're ready to open up to, whether you were expecting it or not. Sometimes our instinct or our reaction is, wow, I have to know exactly what to say. I have to know exactly what to do to fix this situation for this person. Or in order to support this person, I have to go the extra mile to maybe make the appointment for them, or I have to be able to meet their every need during this difficult time. And I just want to remind you that oftentimes what these people need, if we see or if we just happen to experience them releasing a lot of emotions or letting us in to this really vulnerable place, first of all, it's an honor to be welcomed in to that area. And second of all, is that oftentimes what they need is just a listening ear, is just someone to listen without judgment and to be empathetic, which empathy really just looks like, wow, that's really hard. I'm so sorry you're going through that. Not having a fix, not having a recommendation. Oh, have you tried this? Do you think you should do this? Or, I did this and that really helped. Sometimes there's a place for that advice, but oftentimes our first reaction should just be validating and listening and recognizing that, that emotion, whether it's anxiety, whether it's depression, whether it's the feeling of loss, disappointment, we've all had those emotions at some point, even if we haven't experienced exactly what that person's going through. So we can tap into that emotion and our own experiences and say, yeah, I know what that experience, I know what that emotion is like. I don't understand exactly what you're going through. And sometimes that can be kind of off-putting if we say, oh, I know exactly what you mean, because we don't. But if we can say, I have felt depressed too, and I know it's really hard, and I'm sorry you're going through this. and I want to support you. And just letting them know that simply is sometimes enough.
Thanks, Lindsay. Yes. And sometimes, advocating here just to, again, for those that are living with somebody that's experiencing a brain health concern, or again, that their self care, they might even talk to you, very engaged in some good self care, but are still having kind of some chronic concerns. Again, we can be that active listener for a while, having that gentle discussion. And then maybe at some point, yes, what do you think about, or we're not there to fix that person, but maybe help them get to the right kind of support. So we talked a lot about different symptoms earlier, or what people are going to experience. And it's a lot to keep in mind. We do tend to, especially in trainings or talks, have these long lists of things, and it's hard to really keep in mind. So if we're in an allied field, or if we're living with somebody or know somebody who's going through some concerns, really noticing that behavior in others, or a self-check for ourselves, is to really break this down to an easier thing rather than thinking of all these symptoms, self-harm, um, you know, concerning behavior, weight loss or weight gain, unless, number one, is it very noticeable? And to really think about three things for ourselves or others. The main one I ask people to consider if we're trying to figure out to have that conversation with somebody is, what is the effect of how we're feeling or what we're experiencing on our life or our livelihood? So, is it affecting my life in ways that, probably more on the more concerning end, is it's affecting our activities of daily living, like showering, cooking, engaging in our hobbies, just taking care of our general wellness, to things as minor as maybe getting upset a lot easier at situations than we should or feel like is necessary. Is it affecting our life, our relationship with our children or kids, our spouse, or just our friends? And also thinking about, does this affect my life and livelihood with how much intensity there is and how frequent it is? Of course, we all get upset and blow up sometimes. We all have maybe a down part of a day or two, and then we come out of it and it doesn't bother us for a long time. Of course, we make poor spending choices occasionally and maybe have some buyer's remorse later. Is it frequent? Is it intense? One person in my history bought 2 boats in the same week, $10,000 each, and then realized they regretted it. So unfortunately, there was some intensity there, even though it was an infrequent thing. That was a concern. So does it affect other people's or your life or livelihood? And a big one is, do other people notice? Especially this is for anyone here talking or looking for themselves. Do others notice how I maybe respond to a situation? Has my boss brought up concerns, or my manager or a friend? And they might either be very direct, if you all have those friends or managers who might say, you have this concern. Hopefully it could be more gentle. However, it's still somebody is noticing. Or maybe friends or family have been very gentle, saying, hey, we noticed you've been staying up late frequently. Hey, we noticed you haven't been coming over very often. You seem a little isolated. How much do other people notice? So rather than thinking about every checklist, whether or not people consistently bring up the same kind of concerns. And for those here searching for yourself a bit, is, how do I honestly feel? Because again, like some of our myths, maybe I'll just feel better tomorrow. Well, that honestly we might. However, how frequent has this been? Am I feeling this way 3 or 4 days a week? Am I feeling this way for more than half the month? So rather than trying to diagnose ourselves, just knowing, is it affecting my life and livelihood? Do other people notice? And am I negotiating with myself? How do I honestly feel about what's going on? So, one of the main questions I really ask for folks to consider themselves is overall, what would you tell someone living with how you're feeling? What would you tell them to do? Sometimes that's a good question is what would you tell someone else living with how you feel? What would you tell them to do? To know, should I maybe talk to a professional in some way?
So this is just a little infographic about when might be a good time to start therapy. The top shows when most people start therapy, which you'll see the whole circle is red, and it is when they are in crisis at a breaking point. It's not that we shouldn't start therapy when we are at that point. That is still a good time to reach out and ask for professional help. We might need more than just counseling help at that point. But a better thing to look at is when we should start therapy. So you'll see there's kind of 4 pieces to the pie here. Obviously, number one is it's helpful to start before we reach that crisis, because typically it's going to mean that it takes less interventions. And by intervention, I mean, maybe we will only need counseling, maybe we'll need it for a shorter amount of time than if we're at that crisis point when we need counseling and we need medication and we need maybe inpatient care, or we need a little bit more intensive treatment because we've pushed ourselves past the point of that crisis. Another one is when we want to learn more about ourselves. So sometimes it's not that we're having all of these symptoms, it's that we all have a family history, we all have woundedness in our past. And sometimes we just want to work on becoming weller than well. Maybe we're not noticing a lot of symptoms. We just want to head off anything so that it doesn't become an issue. Or some of us want to change our family tree, so to speak. So if we notice that, people in my family tend to have kind of anxious thinking, or people in my family tend to react quickly without really thinking through an issue, how can I work on myself so that I can be a better decision maker? How can I work on some of these things that might seem little that can still make a really big impact on ourselves, on our family, on our children, and can change our whole lineage? And then when we want to start having better relationships. So anytime in couples counseling and family counseling, if a counselor can work with a family or a couple before there's been 20, 30, 40 years of built up resentments, you can head off, like I said, you can head off some of these problems before they become really big roadblocks, before people, every time we get hurt, we put up a wall to protect ourselves. And it can take a long time to start to bring those walls down and start to heal relationships. So if we can deal with issues as they come up, if we can deal with them early on, we can set up healthy habits that are going to help us to have better relationships in the future. And then when we feel interested, if we want to, like it says earlier, if we want to learn more about ourselves, if we want to learn about what counseling is, if we want to just become weller than well and start to kind of acknowledge any issues that we might have, is a good time to start therapy. So it doesn't always have to be crisis mode. It doesn't always have to be red flags. It can be prior to that we start therapy.
So kind of with the whole topic we're talking about, both the pandemic, with what that has maybe affected us with, we want to look at also signs that medication might be helpful. And again, because there's a lot of stigma regarding brain health and taking medicines, the concern is a lot of times people are like, wow, I must be really bad if somebody's asking me to take medicines. But some of the things that might show that medications might be more helpful is if there is a family history of brain health concerns. When we go to a doctor or physician, they often ask us about our family history. And that family history can reveal a lot about whether or not there's a biological component to what we're experiencing. I like to share a quick little personal story is that I was diagnosed by the time I was 25 years old with incredibly high cholesterol. And I'm not the greatest eater out there, but my doctor said it was so high I would probably have a heart attack by the time I was 40, which I'm close to now. So I said, give me some time. I really tried to change my diet. I tried those self-care things. I exercised more. I ate much better than I ever had my whole life. And a few years later, I went in for more testing and found out my cholesterol went even higher. And I was shocked. And the doctor said, do you think you'd like to try medicine? And again, stigma outside of mental health or brain health. I said, I really had to think about it. Eventually I said, sure, doc, let's try a really low dose and see what happens. I was skeptical. And about 2 months later, I went in for my recheck after receiving a medicine, and my cholesterol was all the way back down to normal levels. I thought, wow, and I know that's not related to brain health specifically. However, I have a long family history of high cholesterol and heart disease on one side of my family. So there's a family pattern to a lot of our health. And rather than just seeing it as a psychological concern, sometimes our brain health is literally the brain organ itself. We like to think it's different or special, but really it's another part of our anatomy that might need some help, apparently like my liver did. Another sign that maybe a medicine might be more helpful is if you are attending therapy or counseling or someone you know is, and they're maybe gaining skills, but they don't seem to be helping very much, or we don't seem to be able to act on them as consistently as we'd like to, or we're actually still having, as it says below here, difficulty with some of the mood shifts or anxiety or some more of that depression. That, again, maybe the skills in counseling are helpful, but because the anatomy, me doing my exercises and eating right, weren't able to actually take hold for me. So again, there might be some of those other concerns. So really looking at family history, maybe counseling isn't helpful, or for a handful of people I've worked with over the years that they started with me and they decided to go on medicine very early and utilize that support. And they felt so well so quickly. And that to me said, well, they had less psychological concerns to address. They actually had more of a brain health concern that they needed help with. They felt fine and were able to stop their counseling sooner than later. So once again, in this discussion, there's just lots of barriers to seeking help. Anxiety about the unknowns, not exactly sure where to start, finding the right kind of fit for us, especially if we're seeking therapy or medicine sometimes, or someone we know is encouraged to go do that. Sometimes we want to try just one thing, and if it doesn't work, we give up on it. Versus saying, I got to find that right fit to get that kind of help. And I like to say, even as a therapist, sometimes individuals who come to see me, I'm not the right fit for them as their first therapist. My techniques, my personality might not be that right fit. Or if you're seeking or seeing somebody in therapy at this time and you don't feel like it's the right fit, the therapist has not brought it up, I ask to please talk to them about that. Hopefully, if they're a healthy therapist and willing to work with you, they'll have an honest discussion about that. And if needed, help you get a referral to at least to try to see somebody different. A saying I like to use is I'd rather have people quit therapy with me, quit the therapist, versus actually just quitting therapy altogether. Because sometimes we just need a different fit. And that same thing goes with medications. Sometimes they might help, but they're not quite the right fit in finding the thing that's right. One of those other big barriers tends to be financial concerns. How can I afford that? Not having insurance. And sometimes it's about finding the time to do it. And of course, as we talked about earlier, a few of the myths and stigmas surrounding it is more of an internal barrier, or people we know will actually turn us away from it with various statements.
So we have about 15 minutes left. So I'm just going to talk about this slide briefly because I want to make sure we leave room for questions. Our next talk, we are going to go even more in depth as to if you've decided that, you know what, a counselor might be a good idea, a good next step for me or for my loved one or someone I know. What next? I think there's a lot of barriers to finding that counselor, like Todd said. We'll talk about how to go about looking for a counselor, how to know if it's a right fit, what to be looking for, what to expect from counseling, maybe what not to expect from counseling, just to break down some of those barriers to make it easier to seek help if you need to. So it'd be a great one where if you know someone who you think would benefit from counseling, you could offer to watch it with them or watch it with them later. Or for yourself, if you want to get on and learn a little bit more or ask some questions, that'd be great. Just so you know, like we said earlier, we do offer counseling. We accept all major insurance companies, including Medicare and Medicaid. We have a sliding fee, so we offer reduced rates for people who might not be able to afford counseling elsewhere.
So one of the things here that I like to provide, and if people have phones and they need it for themselves or somebody else, some resources to find counseling. And unfortunately, people might be joining us from various areas around Dubuque or around Iowa. So one of the tools that I find very helpful is actually from a magazine called Psychology Today. And as a part of joining their magazine for the professional, you can post your own profile and be listed as a therapist, under their resource or referral system. So sometimes when I have to find a colleague or someone to recommend, even though I might not know them personally, at least I can find a counselor in a given area. So Psychology Today is typically more for private practitioners versus a community-based mental health center. So that's just a good resource to type in. Frankly, if you go to Google and type in counselors in Dubuque, Iowa, you will come up, probably Psychology Today will be one of the first 5 links. Clicking on that, you can scroll through the people who are probably in Dubuque, Iowa, for example, and people who are within so many miles of that. So a very useful resource. Just our own website there, if people would be interested in that for any reason. And another one, and this is more for public-based counseling or mental health centers, is the Substance Abuse and Mental Health Services Administration, their Fine Treatment application or program, which actually brings up a map of Iowa, and it will show with the different links that people can, or options people can select, various providers in an area. So for Dubuque, Iowa here for mental health, there would be Hillcrest Family Services. But in like Cedar Rapids, it brings up the Covenant Health Systems, any other hospitals like that, some Trinity hospitals. So it's something people have to play with a little bit to find what they specifically need, but it's a great resource to find counseling specifically.
All right, so this next screen, maybe we can just leave up for a little bit as we enter into question time. It has some different crisis numbers. We encourage people, if you want to take a picture of the screen or if you want to log any of these in your phone for yourself or for someone else, it can be helpful to have these on hand in case you or someone else feels like they're in crisis. Some of them are specifically for suicidal thoughts, like the National Suicide Prevention Lifeline. Other are for just any kind of mental health issues. If you just want somebody to talk to, those would be like the warm lines. If you feel like you need a support right now and it's 10 o'clock at night, you're not going to get in with a counselor, you can call one of those. And then there's other crisis lines where maybe you find that you're in the middle of a panic attack. Maybe you find that you are having a lot of depressed thoughts, or you're ruminating a lot on some anxious thoughts, and you can't stop yourself, or you find that you've been crying for a long time and you feel stuck, those would be a great resource to call. Those statewide Iowa crisis lines, the Foundation to Crisis Counseling, those are some resources for you. So if now we can enter into question time. So if anybody wants to ask a question, you want to type your questions into the chat, this time's available for you to ask whatever you'd like. All right. Does anybody have any other topics maybe that they'd like to see presentations on in the future if we were to continue this? Are there any things that we didn't cover that you would have liked to have heard more about, or any different subjects? Thank you. Do you offer telehealth services? We do offer telehealth services. So it was something that we started during the pandemic. And even after the pandemic, we're planning on having someone devoted specifically to telehealth services. So basically what that means is that over the computer, we would have a chat similar to this with just you and your counselor. So you could be at your house, as long as you're in the state of Iowa, we can see you. You could be at your house, you could be at work, and you can meet with your counselor that way, face to face through the computer. All right. Well, thank you all so much for joining us. We really appreciate it.